Hello, everyone. My name is Stephanie Brennan, and I will be covering Chapter 44 regarding heart failure medications. Heart failure is a condition that involves a dysfunction of the cardiac muscle. This leads to decreased cardiac output and decreased contractility of the heart. Heart failure can occur with any disorders that damage or overwork the heart muscle. These include coronary artery disease, which accounts for 95% of all cases of heart failure, cardiomyopathy, hypertension, and valvular heart disease. Right-sided heart failure and left-sided heart failure differ in the symptoms that the patient may have. For right-sided heart failure, patients may have elevated jugular venous pressure, splenomegaly, which is swelling of the spleen, hepatomegaly, which is swelling of the liver, decreased renal perfusion when upright, increased renal perfusion when supine, which leads to nocturia, pitting edema, weakness, and fatigue. For left-sided heart failure, patients may experience symptoms including anxiety, tachypnea, dyspnea, orthopnea, hemoptysis. That you may hear rales. They will also have cardiomegaly, which is enlarged heart. S3 sounds may be present on auscultation. They may have an increased heart rate, GI upset, nausea and abdominal pain, decreased peripheral pulses, and hypoxia. There are 4 different types of treatments for heart failure. The first one are vasodilators. These are ACE inhibitors and nitrates. They decrease the cardiac workload and relax the vascular smooth muscle to decrease afterload and preload to help improve function. Second, there are beta-adrenergic agonists that stimulate the beta receptors in the sympathetic nervous system, increasing calcium flow into the myocardial cells and increase contraction. The third, we have human B-type natriuretic peptides. They bind to endothelial cells, leading to dilation and resulting in venous return, peripheral resistance, and cardiac workload. They also reduce the body's response to stress, leading to increased fluid loss and further decreased cardiac workload. And lastly, there's the cardiotonic agents, which are inotropic. These are the drugs that I'll be discussing more so in this chapter. They affect the intracellular calcium levels in the heart muscle, leading to increased contractility, and this leads to increased cardio output, which helps with heart failure. There are 3 cardiotonic agents to help with heart failure. These include cardiac glycoside, phosphodiesterase inhibitor, and an HCN blocker. The cardiac glycoside to treat heart failure is digoxin, or brand name Lunoxin. This is treatment of acute heart failure and atrial arrhythmias. The phosphodiesterase inhibitor is the milrinone. It's just in a generic form. It is for the short-term management of heart failure patients in adults receiving digoxin and diuretics. The HCN blocker is ivabradine or Corlenor. These reduce the risk of hospitalization in stable chronic heart failure patients with an EF of 35%, which is their ejection fraction, and their heart rate must be greater than 70. Nursing assessments prior to use. You'll assess for contraindications or cautions including allergies. You'll perform a physical assessment to establish a baseline status before beginning therapy. Assess patient for weight to monitor for fluid retention. You'll assess the cardiac status including pulse and blood pressure so changes can be monitored. You'll assess lung sounds for adventitious sounds and evidence of left-sided heart failure, and you'll get a baseline ECG. You'll monitor effect, orientation, and reflexes, monitor laboratory results for electrolytes and renal function. You'll check for GI motility and voiding patterns. Assessments for effectiveness of these drugs include monitoring the patient's response to the medication, including improvement of heart failure symptoms and resolution of arrhythmias. You'll also monitor for adverse effects and if the patient is experiencing any of these. You'll monitor for comfort measures and regimen compliance, make sure the patient is taking their medications every day as prescribed. And you'll evaluate the teaching plan with the patient, including the name of the drug, dosage, proper administration, adverse effects to be aware of, and how to avoid them. It's important that these patients take these drugs every day, even if they start feeling better, because this is It's something that needs to be treated regularly or they can get worse. Possible adverse effects for these medications include headache, weakness, drowsiness, vision changes, GI upset, anorexia, arrhythmia, malaise, depression, chest pain, hypertension, thrombocytopenia is associated with milrinone, and bradycardia. My mnemonic is DMI, which is for digoxin, milrinone, and ivabradine, and it's disturbingly muscular Ironman. This is my reference. It comes from our pharmacology book.